Hello everyone, I am Dr Mutya Latha, Consultant Obstetrician and Gynaecologist, Motherhood Hospital, Hebbal. So pregnancy is a blissful moment for every woman in her life, and it's challenging because of the sometimes tough birth process. Today I am going to discuss some important aspects about different modes of delivery. There are three modes of delivery. The first one is the normal vaginal delivery. This can be spontaneous or induced. Spontaneous, where the patient enters into labor without any medical intervention, or it can be an induced one where the patient doesn't go into labor on the stipulated time. We have to induce her labor with some medications. Whether it is spontaneous or induced, if the patient has a vaginal delivery, it benefits the mother as well as the baby. For the mother, there is a lesser hospital stay post delivery, lesser pain, less trauma, less infections, and less bleeding. And of course, faster recovery. She can take care of the newborn as early as possible. And for the baby, when the baby passes through the vaginal birth canal, the fluid in the lungs is squeezed out of the lungs. So these babies have better breathing initiation when compared to caesarean delivery babies. And when these babies are passing through the vaginal birth canal, they are exposed to the bacteria in the birth canal, so that they can have a better gut immunity in the childhood as well as in adult life. The next mode of delivery is the assisted vaginal delivery. In these deliveries, vaginal delivery are assisted by some special equipment like forceps, ventouse or kiwi forceps. So these type of deliveries are done to expedite the delivery process in cases of severe maternal exhaustion or in cases of fetal distress. So the purpose of faster delivery is served with this type of delivery, but it is slightly more traumatic, more bleeding and more pain and more infections when compared to normal vaginal deliveries. So the third mode of delivery is the caesarean section. This is the most common obstetric operation performed. In some situations, instead of compromising on the maternal health or the fetal health, it is always better to take an early decision for caesarean section. So caesarean section can be done on an elective basis or on an emergency basis. An elective caesarean section is one where the patient is informed prior that she has to be taken up for a caesarean section. So in some conditions like example twins, where especially when the first baby is a non-cephalic presentation, breech presentations, any other malpositions of the baby, if the patient is having previous 2 or 3 caesarean sections or any other surgeries on the uterus, or the patient is having active genital herpes infections or a severely compromised fetus, in these cases the patient is taken up for an elective caesarean section. And in emergency caesarean section, these patients are allowed to have a vaginal delivery, but due to some unforeseen conditions for the mother and the fetus, they are taken up for an emergency caesarean section. Safest mode of delivery, this cannot be generalized equally for all patients, because every pregnant woman is different. Whichever mode of delivery is safe for the mother and baby is the safest mode of delivery, and the ultimate goal is to have a healthy mother and a healthy baby. So every woman is intended to have a normal delivery. That means her birth canal is designed in such a way that she can have a normal delivery. But it is not possible at the time of conception only or in early months of pregnancy whether a woman can have vaginal delivery or caesarean section. Because pregnancy is a journey of 9 months, and during these 9 months, some pregnant women may develop complications or complications during labor, which might change the mode of delivery. So there are two important reasons for this. The first one is the maternal attitude towards the mode of delivery has changed widely of late. So nowadays we see many couples are voluntarily opting for caesarean section because they have a negative opinion on vaginal delivery. This can be due to their fear of labor pains or fear of passing through 2 painful events, that is trial of vaginal, and if it fails they have to undergo a caesarean section. Some patients have negative birth experiences like inadequate pain control during her previous deliveries or birth trauma to the mother or fetus. And some patients have negative birth experiences from their friends and relatives. So the second important reason is caesarean sections are done for the safety concerns of the mother and the baby. Currently, high-risk pregnancies have become very common, and we see many complicated pregnancies. This can be due to increased maternal age at the time of conception, changes in the lifestyle. A sedentary lifestyle and stressful lifestyle can lead to pregnancy complications. Again, IVF conceptions are very common, which is again seen in elderly age group, or most of them are twin pregnancies. So what we can change of these two reasons, what we can change is the maternal attitude towards the mode of delivery. So if you are due for a delivery, do not hesitate to have a vaginal delivery. For this, attend antenatal classes, take regular antenatal checkups, understand the labor process, talk to your doctor how she is planning your delivery, and talk about painless labor. Nowadays we have many injections like sufentanil, pethidine, Entonox, which is an inhalational anesthesia, or more commonly used epidural analgesia, all of which are very effective in relieving the pain of labor. So trust your body have the capacity to tolerate pain and also to deliver vaginally, and most importantly, trust your doctor. So to ensure that you have a normal healthy pregnancy and a normal vaginal delivery, so I advise all of you to attend antenatal classes, have regular antenatal checkups, follow your doctor's advice time to time, and then eat right and healthy. Don't consume too many calories and remain physically active. Exercise for at least 15 to 20 minutes. Enroll yourself for antenatal classes and prenatal yoga classes and have a stress-free life. Thank you.